if you're listening to this podcast and you are feeling that stress, I just want to encourage you, just start small. One very small thing that you can do, and maybe try to do it for a month, and then it'll become a habit, right? And then move on to the next thing. Don't stress yourself out.
Hey, this is Rob Renee with the I Am Painfree podcast, and welcome back. Have an awesome show lined up for you today. We have Alexandra Yu with us. How are you, Alexandra?
I'm good, Rob. Thank you so much for having me on the show. I'm so excited. I've been listening to some of your podcasts. You've had some great guests, and I'm just so excited to be here. So thanks, Rob.
Yeah, I'm excited to have you here. I know it's a little bit of struggle getting with our schedules and stuff, but we got it lined up. We're here together today, and we're going to have a lot of fun. I love learning about people's stories, and you have a very interesting one. So I'm excited for you to share more about you and who you are. And so why don't we just start off with that? Why don't you give us a little bit of background of who you are and what you're doing and what brought you to what you're doing today?
Sure. I guess I'll go all the way back to when I was a kid. I've always been on the thin side. So adults would come up to me and be like, wow, you're thin. I used to be like you. You should eat whatever you want because when you're older, you're not going to be thin anymore. So I actually took their advice. I started eating anything and everything, all the candy, processed food. I was eating that already, but I mean,
Right.
I did that even more. So I just did that until I started to have health issues of my own. That was actually after I became a nurse. And actually, let me go back a little bit. When I became a nurse, I just remember I was working on the medical surgical unit. That's a unit that they have for patients that are admitted to the hospital, but they're not sick enough to be in the ICU. So we got a whole bunch of patients, and I would just be on shift, and I would think, man, these patients, they come in and then we give them their meds, they go out, but then they come back again. And the charge nurse would have a name for that. She would call them frequent flyers.
Wow.
And I just thought to myself, man, are these patients getting better? Are we doing anything right by them? And so fast forward, a family member of mine was diagnosed with diabetes, and actually this was before I was a nurse. So I went to the doctor with him and I said, hey, doc, if he changes his diet, if he exercises more and all that, can he get off his medications? And the doctor was like, nope, he'll be on these for the rest of his life. So that's what he's got to do. And I didn't like the answer at all.
Yeah, good for you. I'm glad you didn't like that answer. Because that is not the right answer.
I wasn't a nurse yet. I didn't know anything about health, but I went on Amazon and I found some books and I read all the reviews and I'm like, man, there's people that have been healing from a lot of things naturally. So that was like my first, when I started to question things, and then I became a nurse, and then I started seeing these frequent flyers, and then I had health issues of my own. But when I was a kid and I would take medication, I would always have the worst side effects. I would throw up and I just hated medication. So I started down this path of learning all about natural remedies, healing foods, and I just became so fascinated with all of that.
Nice.
And it worked for a while, but then after a while, the things that I had been trying previously, they didn't work as well. And so that was when I grew up as a Christian, but it was at that point where I felt like God asking me like, hey, who do you think made all those natural remedies and those healing foods? And so I dug into my Bible more. I started learning what the Bible says about healing.
Oh, awesome.
And I really feel like God was showing me that a lot of my health issues were occurring because I wasn't trusting in him. I was under stress. I wasn't taking care of my body. So that's when I really got a really huge holistic picture of what affects the health, the spiritual, the mental, the social, the physical, and the environment. And I just fell in love with holistic health and just more in love with God. And now it's really my mission to encourage women to seek God's wisdom first for their health and their life, so that they can make a bigger impact in their family and in their community. I think it's really important to go to God first because he made our bodies and he knows what's best for us. So that's my story in a nutshell.
Wow, that's so beautiful. And obviously, this is a divine connection just because that's exactly what I've been doing recently, especially is really leaning on my faith in the health journey. I do talk a lot about the God made our bodies so incredibly complex and wonderful that if we do what the body needs and we give the body what it needs, it can heal itself. Imagine that, right? But then you start talking about things like the whole mind, body, and spirit connection is so real and so important that I don't think people understand how important that is. And so I'm super excited to dig into this with you because I am 100% a true believer in everything you just said, right? I believe that God made us this incredible body. He put on this earth the elements and the superfoods to help us what we do need. And guess what? If we just treat our bodies the way we're supposed to, then our bodies can and will heal themselves. But like you said, the body is more than just the mind, body, spirit connection is in the environment you mentioned. All those things come really into play. So this is fun. I'm super excited and blessed to have you on the show. So how long were you in nursing and what happened? Did you stop doing nursing and start doing the more holistic things? And what brought you to doing what you're doing today, helping women in this way?
I was first a nurse in 2008. I was a medical surgical nurse for about a year. I also volunteered at a clinic for about a year, but then I worked in the clinical research industry for a very long time. So I worked in drug safety. So I wrote drug safety reports.
Oh, wow.
And I read the medical literature to look for drug safety issues. And that's where I found that the drug safety system, the pharmaceutical industry, is not as great or as safe as we thought it was. So I did that for many years. And then it was in 2022 when I started Her Holistic Healing podcast, and I wrote a book.
Oh, fantastic. What's your book called?
It's called Discover God's Health Wisdom, Exposing 8 Common Myths That Keep You Sick.
Nice. That's fantastic. And you wrote that when?
It came out 2023.
Okay, nice. Fantastic. So what have you been doing since then? Do you have your own practice or clinic, or what are you doing today?
I do some health coaching on the side, and I've been working on an online course. Nice. I'm still actually involved in the clinical research industry, so That's basically what I'm up to.
Ah, very good. Yeah, I'm glad that you, being in the industry, that you even recognize that our medical system is not as glorious as many appear to make it. So that's one of the things that woke me up 5 years ago, was realizing as I was doing research on COVID, that kind of was like, I call it the second truck that hit me, is like when that hit me, I lost my job, and for the first time had time to research things for myself. And man, I started doing research on what was going on in the world. And I saw the vilification of this doctor. He was just talking about vitamin D. He's like, hey, vitamin D is something that's very helpful. And I was like, I was an athlete when I was younger. And I'm like, of course, vitamin D is good for you. But then I saw them vilifying this doctor. I'm like, man, he must be a really bad guy, right? This doctor must be really bad. So I started doing research on the doctor. I'm like, what's wrong with him? Why are they going after him so hard? And I couldn't find anything. I'm like, this isn't adding up. And so then I started figuring out, okay, they're vilifying him for a reason. What is that reason? And then the more I uncovered, that's when I really woke up to what I call a medical cartel. It's just like really a system that's set up that is really unfortunate. It's not, the medical system isn't as we think it is in the United States. And so it's really owned by a big pharma, and we can go dig down that rabbit hole, but we don't need to today, right? We're here to talk about you and how we're going to help people. But the good news is that you also, being in the industry, saw it from a different angle, right? You saw it as a nurse. Hey, these freaking flyers are coming in. We're not really helping people with the core underlying problem. So why is that? And you started doing your own research, right? Even a family member had diabetes. You're like, hey, isn't there a way to help people like this? And man, of course there is. So that's what's so wonderful, that you went down that rabbit hole, or went down that path to holistic healing because it's an exciting one, and one I've been going down the last 5 years, and it's just I could never learn it all. It's every day I learn something new, and it's really super fascinating and fun to do that because there's so many remedies and so many things that we can do to help people that God, like you said, made us this incredible, complex body. Let's give it what it needs. Well, I'm interested to see what are the eight things, or do you want to walk through those as part of your book, or what do you think the next step, what would you like to chat about?
Sure. Okay, so I can go through some of the myths.
Okay.
Is that what you want to go
Sure.
over? And you can stop me or we can move in a different direction.
Let's talk about that for a few minutes.
Okay, so one of the myths is if a health protocol worked for someone else, it will work for me too. So when I was on my health journey, I felt like different health gurus say different things. So I was so confused about what to eat that my weight dropped down to 90 pounds.
Wow.
And the truth is, it's my belief that there isn't really a perfect diet for everyone. Every body is different. We're all uniquely made by God, which is why I believe we should be asking God on what we should eat and what practitioners to see. One person would say, I had cancer and I went on the keto diet and it was fine. And then another person would say, oh, I did the paleo diet. I couldn't have a baby for so long and I went on the paleo diet and I got pregnant. I think a lot of diets and a lot of supplements and a lot of protocols, they're great. But like I said, just because they work so well for one person doesn't mean it will work the same for you. So that's why I always go back to we need to go to God for wisdom first when it comes to our specific bodies.
I love it. I think it's a great advice just in general, right? Seek first Him, and then He'll help us give us the wisdom that we need to do the things that we need to do, or He'll bring the right people at the right place at the right time for us. So I love that. All right, so there's one myth. I like it. What's another one?
Another one is if the treatment didn't harm someone else, it won't harm me either. So if a neighbor took a specific treatment or a specific protocol that has a ton of side effects and they were fine, it doesn't mean that you'll be fine because we all grow up in different environments. We all have different genetics. We all have different sensitivities. So that is another myth. Another one is if the drug stopped the symptom, my health has improved. I give an example of I'm in a hurry and I'm driving down the road and then my gas light turns on. But instead of going to get gas, what I do is I tinker with the car and I turn off the gas light. And then I drive on my merry way. What happens? The car stops because I didn't address the underlying issue. I didn't go get gas. That story is actually fake. I don't actually do that. But a lot of times we do that with our health. A gas light or a symptom our body is showing us that something's wrong. The gas light turns on, but instead of giving our bodies what we really need, we just find a way to turn off the symptom. But then we're still left with the underlying issue. So the point of that is that we need to try to find the root cause. We can't just turn off the symptom and think that we're healthier.
Yeah, and I think that's so indicative of the healthcare system that we're in today. As as I was researching when I was starting the podcast, right? I was like, okay, what are the big problems that people are having in the world today? And two of the biggest problems were pain, which is why I created the I Am Pain-Free podcast, is to help people live pain-free and naturally and faithfully. But then also the one I've been working on recently and spending a lot of time on is fatigue. It's amazing how many people have lack of energy, and then just the toxins in the environment and the water and the air and the foods that we eat just are creating really bad problems. But I think it's so related to what you're talking about is most people, the medical system today, when I was doing that research, get back to the reason why I was going down this topic, was the average senior is on 15 different prescription medications in a year. So they take 15 in a year. That's just absolutely insane. And every drug, as being in the industry, has some type of side effect. No matter what the drug is, it has a side effect, and it may not affect somebody, but more than likely, if you're taking 15 of them, you're going to have a side effect. And then if you're not, it's just masking the problem. They're just masking problem after masking a problem, and they're not fixing what's the underlying cause for that? And that, I find that so fascinating. In fact, I had a recent example of that I love to talk to people about is their mouth. It's amazing how many people have dental issues that are causing problems throughout their entire body that they have no awareness of. So you may have a problem in your ankle, and I'm 100% serious, that is literally caused by a root canal that you have in your mouth. And that root canal may be a root canal which is not showing any signs or symptoms of any problems or inflammation, but it still could be infected. And since it's a dead tooth, it shouldn't be in your mouth anyway. That infection can go down to an area into your ankle. And you could be having an ankle problem. You're going to go see the ankle specialist, and he's going to podiatrist or whoever else is going to help you. And he's going to give you some remedy that I guarantee you is not going to be your mouth. Right? It's just crazy how we have to go back and look at the human body and what it is and does and how it all interacts and works together. And that's why I find this holistic medicine fascinating. And the Lord connection to all of this is he did make us this incredible body. It's so complex, right? Who knew that the mouth had literally direct connections through your bloodstream to your entire body? I didn't until I researched it and found it out for myself. I had no clue. So it's just fascinating as we go down this. But I love the fact that you being in the field, you understand that people are treating symptoms rather than what's the underlying cause, right? So let's go figure out what the underlying cause of that family member that has diabetes. Why are they getting diabetes, right? And how can we help them reverse that particular component? And I love it. You seek first the Lord, right? And you ask him, and then we go from there. So sorry to derail. I just thought that was, you love what you're saying. Everything you're talking about just feeds into my whole life. So I love what you're doing. One of the things I loved, like I mentioned during that discussion, was fatigue. So obviously you help people being a nurse and the health coaching and stuff you're doing. I'm sure you help people with fatigue. So let's talk about fatigue for a few minutes. How do you help people that come to you to say, hey, I have no idea what's going on, but I'm exhausted?
Sure. So like I've said a couple of times, first thing, I always encourage everyone to ask God for wisdom, because James 1 says he gives generously to all who ask. So I would say that's the first step. Ask God for wisdom, ask him for healing, and ask him for wisdom. Next, I like to talk about the 5 different categories of health: spiritual, mental, social, physical, and environment. So if you're having fatigue, if you're having low energy, there could be so many reasons for that, right? And I don't know what your thoughts are on this, but I like to mention this a lot because I feel like a lot of people don't. This is something that I want you to consider. A lot of health issues, or I don't know a lot, but at least some of them can be due to spiritual warfare. So that's just something I want to put on the table, okay? So when we're thinking about fatigue, that could be so many things. It could be a gut issue. It could be emotional issue. If we don't deal with trauma that's happened in our lives, even that trauma that's happened to us as a kid, that can be causing fatigue, low energy. And then, of course, it could be our diet. It could be the products that we're using, the environment, all of this, mold. There are just so many different things that can cause fatigue. So if you're dealing with fatigue, and first I would ask, I guess, what type of person are you? Are you the type of person who likes to jump right in and make all the changes? Or are you the type of person that wants to just take one step at a time? Because there are so many things you could do, but I'll talk about some of the easier things that you can do. Are you getting enough sleep? That's something and I was listening to your podcast, the guest was talking about sleep. I feel like we underestimate the power of sleep. And are you getting good quality sleep? How much sleep are you getting?
That's when our body heals. Right? Literally, that's when your body heals, is when we're sleeping. Man, if you're not getting enough rest, guess what? Your body's not going to be healing the way it should be. And yeah, that's so awesome. I totally love that one. Agree with that one. Sorry to interrupt. Keep going.
No,
you're doing
it's
great.
Okay. So sleep, I would ask, have you had trauma that you haven't dealt with? Are you harboring unforgiveness in your heart? Do you feel like, and I'm not asking you, Rob, but if I was talking to someone Do you feel like it would be beneficial to see a counselor or a therapist, or what is your social life like? Do you have friends that you can call when you're feeling down? That's something those things to me are simpler. They don't cost money, but it's something that we don't consider. Like you were talking about COVID, like when we were all going through it, I was in Chicago at the time, and we were all locked up off and on for 2 years. It felt
Right.
like 2 years. And that was really hard for all of us. And for someone like me who loves being around people, that can really affect your health. That can make you feel fatigued.
Yeah.
Just if you take a look at your life, like what is your daily rhythm like? The Bible talks about taking a Sabbath. Are you taking the Sabbath, or even taking like a mini Sabbath? Do you take rest throughout the day? Like for me in the past, what I would do is I would wake up right away. I would get ready. I would go to work, go home, make dinner, take care of the kids. I wouldn't take 5 minutes of rest for myself. Of course I got sick. Are
Yeah.
you resting at all?
So many
No.
moms do that, right? Like you said, it's
Mm-hmm.
like holy smokes, and
Mm-hmm.
everyone's forced to have two jobs, right? So every woman and man, you typically will, or at least dual income families are prevalent today because of the way our society is. That man, this just makes it hard, especially for a woman. Right? So I totally get it. I love where you're headed with that.
And then if you want to, I know I'm throwing a lot of things out there, but if you want to dig into your diet, what is your diet like? Are you eating a lot of processed food? Are you eating a lot of sugar, fake sugar, aspartame, high fructose corn syrup, things that I believe that poison our body? And yes, I eat it too, but how much of it are you eating?
Yeah, it's amazing. It's so hard. Literally, I'm going through this health kick right now where I'm like, I'm on a very strict diet. So in order to do that very strict diet, it's like so difficult to do in our society. It's like everywhere you turn, there is ultra processed food. It's like everywhere, everything that most people eat is just not healthy for you. And so you start looking at that and you're like, my gosh, how many years of my life did I do that? Where I just, hey, I'm busy. I was an executive. I'd get something really quick and maybe I'd skip breakfast. And then lunch, I'd be out entertaining clients. We'd take them out to lunch and we'd take them out to dinner. And so it was like, and the food was not typically healthy food. And it's just, oh, you're on the way home, got to grab your Starbucks or you get it in the morning. It's just like all these things are just unhealthy. They're so processed that it's really difficult when you're trying to live a clean, healthy diet. It's not as easy as you would think it would be. And it's just the way our society has designed, or we've designed our society, or however you want to look at it. Just the diet thing is fascinating to me now that I'm going through it so stringently that, my gosh, it's amazing how bad I've eaten myself in the past. It's like, wow. And it's just when you try to actually eat healthy, it's not easy to do. There's not as many options as you thought there would be.
Yeah, and I just want to provide some encouragement there, because I feel like some people, when they start learning about these things, they feel like, oh, I have to cut this out and I can't do this and I can't do that and I have to add this. That can stress you out even more.
Yeah.
So if you're listening to this podcast and you are feeling that stress, I just want to encourage you, just start small. If you're the type of person like me who doesn't like vegetables and you never eat vegetables, just maybe try adding one new vegetable this week. That's just one very small thing that you can do, and maybe try to do it for a month, and then it'll become a habit, right? And then move on to the next thing. Don't stress yourself out. You would be surprised. Just the little step that you take, it will encourage you. And depending on what you choose, if you choose to do more sleep, it will make a huge difference. Just the smallest thing can make a huge difference. And like you said, Rob, for so many years you've been eating processed foods. Well, like you said, God designed the body to heal itself. And even though you've been doing that for so many years, the body is so amazing that if you continue on this health journey, it'll heal. Your body will heal itself, because that's how God designed it. It's okay. We don't have to get stressed about the toxins or our diets. We just do what we can with the budget that we have and just lean on God. That's all we have to do, really. Just make small changes.
Yeah, I love it. One of the things you mentioned when we started talking about fatigue was something like, you're right, that probably 95% of the people I talk to aren't going to discuss spiritual warfare as an issue for fatigue. But so I'd love to walk through that with you a little bit, just because I do 100% believe that there is spiritual warfare going on in our world. We live in a good versus evil society, and a lot of people don't believe that, and that's fine. I get it. But for people who do have a Christian faith and believe in God, let's talk about that spiritual warfare for a minute, and how does that affect people's fatigue?
Sure. This is not an example of fatigue, but there was one time where I had this really bad abdominal pain, and I've gotten to the point where I know if I have a symptom, what's going on. But this time I knew it wasn't something I ate. I knew it wasn't just something strange. I just felt I was being attacked. It hurt to the point where I had to lie down. So what I did was I prayed. I turned on worship music. We have this WhatsApp for the ladies in our church. I put my prayer request on there, and they prayed for me. And within 15 minutes, the abdominal pain was gone. So when it comes to health issues and fatigue, for instance, it could be, I don't know how you feel about this, Rob. I know different Christians believe different things, but it could be you have a demon assigned to you to stop you from whatever God you're calling, whatever God wants you to do. So, I mean, I'm new to, they call it deliverance ministry. So I'm no expert on it.
No, you don't have to be. I just thought it was interesting because I like to even brought it up because just for you to even say that, most people are like, oh my gosh, she's crazy. She's talking about the spiritual warfare, and really do truly believe that we're living in a good versus evil world, and we're living in Satan's world, really, literally. If you read the Bible and what it says, and that eventually for people who do go to heaven and do believe in God, and that do that ascend to heaven, that we have this battle while we're on earth. That is very interesting. So the demonic thing, I've literally been to some deliverance events, and it's incredible to see people who are physically delivered from these demons or demonic things or spirits or whatever you want to call them. But it's absolutely phenomenal to see that, and the people they were before and the people that they are after is just 100% different people. So it's just really, I'm much more open to that. I used to think that stuff was crazy, and now I don't, because I just been and I'm in Texas now, and in Texas it's a lot of spiritual people here, and I've gone to a bunch of different spiritual events, and one of them was I've been to a couple of deliverance things. So it's a real thing. If you don't believe it, fine. You don't have to believe it, but maybe just do a little research on it yourself. And I think you'll find that we're not as crazy as it sounds. I'm glad that, Alexandra, you even brought it up, because most people, like I said, aren't going to talk about it. So I'm just glad to just talk about it for a few minutes. But man, this is fascinating. I love your journey. I love that you're helping people and coaching them. For people to get a hold of you, what's the best way for them to find out more about Alexandra Yu?
So I have a podcast called Her Holistic Healing.
Awesome.
I'm on Instagram, but I don't go on there very much.
Okay.
So you can go to my website, herholistichealing.com, and you can find my email and other information on there.
Perfect. So we'll make sure that we have both your podcast as well as your website links in the show notes, so that people can get in touch with you. So it's been fascinating. Is there anything else just in closing you'd like to chat about, Alexandra?
I would just like to say, for anyone just searching to be closer to God, just waiting for your healing, just remember what it says in the Bible. It says, draw near to me and I will draw near to you. So don't give up chasing after God. He's actually right there. So if you feel like you can't hear him or he's not answering your prayer, just know that he loves you so much. He died for you. I just want to leave you with that encouragement.
Oh, I love it. Thank you so much for being on the I Am Pain-Free podcast. We'll make sure that we have those things, the show notes, and we just super appreciate you, who you are, and how God made you, and how you're helping people and helping women specifically. Just a fantastic thing. So I wish you all the success in the world, and I appreciate you sharing your faith and your journey with I Am Pain-Free community.
Thanks so much, Rob. I really appreciate what you're doing too. Your podcast is great. I've learned a lot from it. I'm looking forward to what's coming down the pike for you. So thanks so much, Rob.
You bet. God bless you very much. And we'll sign it off from the I Am Pain-Free podcast.
Hey everyone, my name is Dr. Dakota Freeman, and I am so excited to introduce you to the incredible benefits of Exodus and the molecular hydrogen generating blend. Imagine a super antioxidant that can cross the blood-brain barrier and the gut barrier, delivering its powerful benefits directly into our cells. That's the power of molecular hydrogen. It promotes a healthy inflammatory response while helping athletes perform at their very best and helping everyone reduce oxidative stress by neutralizing harmful free radicals in our body. Combined with the biblical ingredients in Exodus, you get a transformative health supplement. Feel the immediate effects and experience vibrant health today. Are you ready to transform your life? Try Exodus today.
Constantly exhausted and stressed? Introducing Exodus, the biblical supplement with 7 divine ingredients for real wellness, featuring organic barley grass and wheatgrass, aloe, saffron, cumin, frankincense, and myrrh. Plus a mineral blend that generates healing molecular hydrogen. Experience more energy, less inflammation, and enhanced performance. Exodus is your path to total rejuvenation. Try risk-free with our 60-day guarantee.
Exit the old you at tryexodus.com.